My name is Allison Sanders, student ID number 3266053, and this is my AVMA test video number 4 for clinical pathology 1. So I'm going to go over how to do a blood chemistry panel in-house, but we don't have any patients at the moment that necessarily need it done. So instead of kind of wasting a test, we're going to use the quality control and just do a control on it. So if you were actually using patient's blood, you could put whole blood in here, kind of swirl it around and put it in there. Or you could use serum, put it in the little sample cup and put it in there. With the quality control, we're going to use the sample cup, and it comes with the petrol control. So you're going to go ahead, take the rubber off. This already pre-measures exactly how much you need. So just going to go ahead and put the pipette in there. And then it brings up the correct amount. I'm going to go ahead and put it in the sample cup. And then you're going to go ahead and put that in here. So if we were doing it on an actual patient, you would go to analyze sample and you'd write the patient's name, their last name, and client ID, and kind of go through all the steps. But since we're doing control, you're going to go to instruments, you're going to go to catalyst 1, and we're going to go to maintenance and quality control. When you do this, you want to make sure that you choose the correct one. So this is Q7122. So I'm going to make sure I hit that. And then we're going to go ahead and put these in. And then the quality control on top. And then you want to make sure that all the pipettes are filled. And then go ahead and shut that. You're going to go ahead, run QC, which is quality control. And then hit the button. And then that's how you would do a blood chemistry panel, but we just did it with our quality control. So the cassettes that we put in our Catalyst 1 to kind of run our chemistry panel are lights as well as the quality control. The lights we put in first at the bottom because they're only viable for a few seconds. The quality control is just a small chemistry panel that we put in. Okay, so our results came in. So we're going to go here, going to click them and go to view. As you can see, they're all in the normal values, which means our control is good. So now all we're going to do is go ahead and take the sample cup out, as well as empty this, and we'll just go ahead and throw that in the trash can. If we were doing it on an actual patient that we were doing blood work for in-house, it would have been maybe because they're lethargic, not eating, anything like that. And most likely would have showed either low or high values of any of these, but since we just did the control value, it is all normal. So I'm going to go over how to do a SNAP-4Dx heartworm test. These tests for heartworms as well as the 3 tick-borne diseases, Lyme, Ehrlichia, and anaplasmosis. So they come in these little packages. Before you want to do that, you're going to go ahead and take whatever type of book you keep the records in and write the name and the date. So today's the 13th of April. And then this is for Finn Murray. So it'll look like this, and then once you get the results, we'll put the results there, and then your initials there. I'm going to go ahead and open the test. Comes with the test itself, as well as a pipette. So I'm going to go in here. Get one of these to put the thing in, and you're going to open up the blood. Draw some up in the pipette. And for this test, you're going to take 3 drops of the blood. 1, 2, 3. And then it comes with a conjugate, and you're going to do 4 drops of that. And then you're going to go ahead and invert it a few times. hub of the test. These tests take 8 minutes to run, so we have a timer for 8 minutes. And then you're gonna wait until the blood reaches all the way down there, and then you can go ahead and snap it. While it's doing that, I'm gonna go ahead and label the test just in case if we have more than one running at the same time. I know which one is mine. So I just labeled the side of it with his name. Now that the blood has reached all the way down there, go ahead and snap it, start the timer, and then we'll come back after the 8 minutes are over. So now that the 8 minutes is up, we can go ahead and take a look at our test. So that dot that you see at the top left is the control variable, so that'll pop up anytime you do a test correctly. And since there's no other blue dots anywhere on this, that means my dog fan was negative for heartworms as well as the 3 tick-borne diseases, Lyme, Ehrlichia, and Anaplasma. If he was positive for Ehrlichia, it would show up in the bottom left corner, kind of right there. If he was positive for Lyme, it would show up in the middle, the center, kind of right down there. If he was positive for heartworms, that would show up at the bottom right corner, right there. And if he was positive for anaplasma, that would show up kind of in the middle of the hub. So, since there's no other blue dots except for the control variable, that means that he's negative for heartworms as well as Lyme, Ehrlichia, and Anaplasma. So next I'm going to go over how to do a direct smear heartworm test. These aren't necessarily recommended as a regular test method to test for heartworms. There needs to be a large number of extracellular microfilariae to be present in order to see them hopefully swimming by on the side. Because there needs to be a large number, subtle infections can go unnoticed and be missed. So this isn't the recommended way to do it, but this is another way to do it. So in order to set it up, I have my blood in this little syringe, and then you're going to need 2 sides. Just like to make a feathered edge, you're going to take a drop of the blood, you go back on, take the second side and create a feathered edge. So that it looks like that, and then this is what you'll examine under the microscope. Before looking at it under a microscope, you're going to want to make sure that the slide dries. That way you don't move around any of the cells when you look under the microscope with it. So now that our slide is dry, I already have it set up to start looking under the microscope. Like looking under anything under a microscope, you're always going to start on the lower setting. So I'm going to go ahead and start on that, and I'll see what I can find. And then I'll just go through all 4 settings and see if you find anything. So I'm going to go ahead and move to the next one. So I'm not seeing any extracellular microvilli anywhere on the side, which either means that my patient is heartworm negative or that he has a very subtle infection of heartworms and is not being picked up under the microscope, which is why we would recommend doing an actual heartworm test instead of doing this. This is a nice simple version, but it doesn't always give the most correct prognosis and answers.